Hello, once again. Still David. Still exploring on the theme of today, World Pharmacy Day, which is safety and efficacy of our medicines to our final consumers, who are the patients. A patient can be you, a patient can be me at at any one particular point. Now, just before I talk about MMUs and medication errors, I think there's a small bit that I wanted to touch on. It is called IPSGs. IPSGs are basically international patient safety goals. These are what we do to make the patient safe. Yes. So, uh, number one, I think, is patient identification. How do you identify your patient before you prescribe that medicine, before you dispense out that medicine? At least use two patient names. Yes, if possible you can use the third name, but at least two patient name. You can also identify your patients using the unique hospital identification code, which is unique to every facility. They have both the inpatient codes and the outpatient codes. Another IPSG is communication, effective communication. We need effective communication to avoid medication errors. Remember, when you're handing over your work to the next shift person, you need to communicate effectively so that we avoid, before you administer that medication, there should be effective communication between the caregivers, that is very key. And also another IPSG is, I think, touched on high alert medications. What are high alert medications? High alert medications are basically these medicines that has very high chances of causing risk or patient harm when used in error. Most of them are kept in double lock doors, under lock and key. Some of them you'll find them in DDAs and all that. And most of these high alert medicines should not be kept in open IP areas. They should be kept in the inpatient pharmacy under lock and key. A good example of a high alert medication is the chemotherapy drugs. We also have the insulin ranges, oral hyperglycemics, you name them. Another IPSG goal is reducing or maintaining infection control in your facilities. That goes on hand washing, starts with hand washing, put the sterilizers at areas where patients can access them, everybody can access them. Teach both the healthcare givers and the patients on the correct steps of hand washing. Yeah. So I just thought that was just a small topic to give us a small idea on international patient safety goals. So I'll go straight to medication management and use. Now, as we had said, medication management and use is a multidisciplinary topic. It touches on organization and management, touches on selection and procurement. It also touches on storage of your medicines. There's also the part of prescribing, transcribing the medicines. There's also arranging and dispensing the medicine. And finally, I think the last stage is monitoring. How did the medicine work? What was the outcome of the medicine on that particular patient? Now, MMUs are a very important part in maintaining safety and efficacy of medicines to our patients. And most facilities have developed several strategies and tools in which they monitor the medication management and use. There are some where the pharmacies do the prescription audits. There are places where the pharmacy do the interventions. There's a lot of communication between the pharmacy staff and the doctors, and all these aims. There's a lot of documentation of medication errors, a lot of documentation of sentinel events, near misses. There are a lot of recording and documentation of adverse drug reactions in the prescribed forms that are provided by the pharmacy and poisons board, definitely. So all this aims at making sure that that patient is safe while using that medication, and also that medication is effective enough to elicit an action or a response to that patient. Now let's touch on selection and procurement. I won't really talk much about that because that comes handy when you are doing maybe your formulary review, depending on the setup that you have there. Every facility is required to have a drug formulary that is reviewed maybe annually or depending on the setup of that facility, but there need to be a drug formulary that dictates which medicines come into the facility and which medicine does not come into the facility. It also has procedures of who makes part of the medicine and therapeutic committee, how to handle drug samples, how to handle medicine representatives, and how to handle so many other stuffs that runs the pharmacy. Also, it is also very important because at the selection and the procurement, that's when you choose the suppliers that will provide you with the potent medications, the right quality medications that will help in producing the best response or results on that patient. Also, another thing is we can pick a little bit on storage of medications. We have narcotics that should be under the DDA, lock and key. We also have products that are sensitive to light. They should be in amber coated containers and also away from light. We also have the fridge items. We should be under the refrigeration, and the fridge items should, the normal temperature of a fridge, of a medication fridge, definitely should be between 2 to 8 degrees Celsius. And you should also monitor the readings at least 3 times a day when you come on your shifts, as you hand over, maybe during the lunch hour and in the evening. In case of any irregularity, you should address that as soon as possible to maintain the potency of the medication. We also have the frozen items, which will need to be kept in the frozen areas. Always make sure that all the medicines are in the right storage condition. That is, you look at your ventilation, you also look at the amount of light coming in, and you also look at the space. If you have to reinforce, you can use stacks. They should be clearly labeled on those shelves. The shelves should be clean enough, and also they should be away from humidity and moisture. We can also affect the quality of the medicine. Away from the storage, we have the transcription and the prescribing area. This one touches on the doctors, and I'll talk largely on it when I'm on medication errors. We also have the arrangement and dispensing. We'll talk also about it in the medication errors. Then we also have the monitoring, which is a very key stage in every facility. But this hindered by the cost required to do the monitoring and evaluation, and also some doctors definitely don't have time to do monitoring, which contributes to medication error and should not be an excuse when it comes to this. Now, medication management and use will also, when you're looking at storage, we'll also talk about high alert medications. Once again, we look at the labs, look-alike, sound-alike medication, and how they can cause errors in the facility. So basically, that is my whole idea about medication management and use. As I've said, it is a whole topic that requires a lot of time and it requires a lot of details to be discussed. But basically, those are the areas which you look at when you're talking about medication management and use. And several facilities have come up with several tools, yes, and systems in which they effectively manage medication management and use. Now, the biggest topic I think of the day would be medication errors. Yes, because this is where we are. Medication error is something that still happens. But as pharmaceutical professionals, we are trying as much as possible to reinforce the discipline, to reinforce the tools, to reinforce the education that can help us to avoid and minimize as much as possible of the medication errors, because some of them, as you know, can cause harm and some of them can result into a fatality. So what is a medication error? Medication error basically means an event. It is a medical event that can result into harm of that patient when they're using that medication. And most of the errors, as you know, happens at the hospital or the pharmacy levels, during either dispensing, during transcription, during dispensing, during administration and all that. Now, what are some of the types of medication errors? Now, we have dispensing error, we have transcribing error, we also have uh, administration of the medicine error, and we also have the monitoring errors. Yeah, so all these are types of errors that can happen in any facility. Now remember, at dispensing level, even at administration level and all that, you are always required to always remember that you are giving the right medication to the right patient in the right route, the right time, the right duration, and with the right documentation. I think this is the stage where it was ignored a little bit. There need to be the right documentation so that when there's a channel or follow up and everything, we can easily see where the problem started. Now, what are some of the causes of medication errors in our facilities? Medication errors are divided into several prototypes. We have the health facility, we have the environmental, we have the personnel's. Yes. So in a health facility, what can cause medication errors? Some of the medication errors that occurs majorly in health facilities are as a result of the staffs of the healthcare givers. Most of them, I think 80% originate from the healthcare givers. You talk about stress, you talk about distractions by the personnel and the patients, you talk about poor communication, you talk about lack of protocols and procedures in some facilities. You talk about poor systems or management in some facilities. You talk about shortcuts. You talk about people wanting to save a lot of time, see patients in a rush, and just go. Talk about lack of handing over properly. All this can lead to medication errors. Yeah, and also let's talk about the environment around you. What is the ventilation like? What is the storage conditions like? Yes, are you given enough education on how to store that medication? Yeah, all this can also lead to medication errors. Yes, so it is a whole topic that can also require a lot of time to discuss, but we'll go step by step. Those are the causes of medication error majorly that occurs in our facilities. Now, what are some of the types of medication errors? As we've said, you can do it from all the way from dispensing to the monitoring stage. When you remember the medication process I think starts from dispensing, then there's transcription, and then there's arrangement or making that medication ready just before dispensing, and then there's dispensing now, and then there's monitoring and evaluation. It's a whole cycle. So medication errors will occur in between those stages. Yeah, so these are where we need to do interceptions and prevent as much as possible of the medication errors. Talk about sentinel events, talk about near misses, talk about adverse drug reactions. All of them will fall here. uh, I will focus today on dispensing and prescribing, because that's where that is the motherboard of all these medication errors. Let's start with the pharmacy. Wrong labeling, wrong patient name, wrong time, wrong duration. You didn't give all those information. There's lookalike medications. Maybe they're the same manufacturers, they have the same strengths, maybe they have the same formulations and all that, they treat the same condition. Those ones can easily confuse you, more so when you're in a rush and you don't check. So there's something called double independent check. Double independent check is whereby you will look at that medication, and then there's your colleague who will also counter check that the medication that you are just about to dispense has been given to the right patient. It can be the right patient in the wrong dosage form. It can be the right patient, wrong labeling, and all that. There's also illegibility. I mean, some doctors just write, some pharmacist professionals just write. The handwritings are not legible at all to be read. Those ones can also lead to medication errors. Yeah, the storage conditions has to be right and has to be standardized. More so the refrigeration, the ventilation, and all that, which I've already talked about. On the prescriber side, the prescription has to be complete with your name, date, and signature. That is mandatory. You also have to write medication for the right condition. In cases where empirical treatment is allowed, that's fine. but we need evidence-based prescribing, whereby this patient passed through the tests, yes, if possible, so that we are true and we are sure that whatever we are treating is right. Yes, so that is the prescribing stage of those medications. Now, when we look at all these factors, how can we prevent medication errors? You will start from the dispensing stage, from the prescribing stage, sorry, come to the dispensing stage, come to the transcription, come to the administration, and also finish up with monitoring. All these things rotate around education and awareness. Our healthcare professionals need to be aware that medication error is a serious event that needs to be addressed as much as possible. So we need to do health talks with the healthcare providers and also the patients. Involve your patient in the medication use. And also another thing that we need to do maybe in preventing medication errors, just be keen. Make sure that is the right label, you're giving the medication to the right patient and all that. And also I think we need to develop protocols, procedures. We need to develop systems in place and put them in place. The pharmacy professionals need to start the revolt. We need to do interventions. We need to do prescription audits. We need to do what we call information with the other healthcare professionals and give them the right information that they need about the medication. Let's have teamwork. These are multidisciplinary thing. It starts all the way from dispensing to monitoring. Let us pump more resources into health talks and education and demonstration of how to effectively use medication. Thank you so much, and let's have a safe and an efficacious 2019. Thank you.